Moving ahead to a concept of the principal fibers of periodontal ligament. Now, the periodontal ligament I told you comprises of collagen. But this collagen is not haphazardly located in the periodontal ligament. There are certain directions in which the collagen fibers are attached so that it can hold the tooth perfectly. And this group of fibers of the periodontal ligament that help attach the tooth to the adjacent alveolar bone, this grouping is called as principal fibers. And we have 5 types of principal fibers of periodontal ligament. The first one is the alveolar crest. Now remember, the crux lies in the name of the fiber group. So if you look at the word alveolar crest, it is talking about the alveolar and it is talking about the crest. So this alveolar crest group begins from the crest of the alveolus and is attached to the cervical part of the cementum. So the alveolar crest, remember, is always going to be slightly below the cervical margin, and that is why when these fibers go from the alveolar crest to the cervical margin of the cementum, it prevents either the upward, that is called as extrusion, or the downward movement of the tooth, that is intrusion. So these alveolar crest fibers prevent extrusion as well as intrusion of the tooth. It also prevents any kind of tipping movements of the tooth. So when you apply a pressure on one side, the tooth will sway, and that is called as tipping. That is also prevented by these alveolar crest fibers. The next group of fiber is called as the horizontal group. Horizontal because they are horizontally located. So they go straight from the alveolar bone into the cementum in a horizontal manner. They are usually located to the cervical 1/3 itself or a little into the middle half. They will not go into the lower part of the root. In the lower part of the root, you have a very different fiber again, which is called as oblique. Now, these oblique fibers again are located from the cementum to the alveolar bone. So, if you look at this picture here, you can see that the direction of the alveolar crest is from the crest to the alveolus, but the direction of the oblique fiber is from the cementum to the alveolar bone. So, these alveolar crest fibers are going from an alveolar crest that is at a lower position to the cementum that is at a higher position. Whereas, in the oblique fibers, the reverse is happening. The oblique fibers are on the cementum in a lower level and the alveolar bone in a higher level. So, the alveolar crest and the oblique fibers are opposite to each other, thereby holding the tooth more firmly in the socket. The fourth group of fiber is the apical group. As the name suggests, these fibers are located in the apical segment of the root and are fan-shaped in their appearance. So, they spread out like a fan from the tip of the root and move in all directions. So, they hold the tooth firmly in the socket, preventing the tooth from going into the socket. And the last group of fiber is the interradicular. Inter meaning between and radicular is root. So, in between the roots of multi-rooted teeth, remember interradicular fibers are always limited to one tooth. So, they will be seen only in multi-rooted teeth. And which are the multi-rooted teeth? You have the maxillary first premolar, which is a bi-rooted tooth. You have the maxillary molars, which are tri-rooted, and you have the mandibular molars, which are again bi-rooted. So, you will have these interradicular fibers only in multi-rooted teeth. And these interradicular fibers will cross the interradicular septum, that is the alveolar bone that is present between the two roots, and attach one root with another. So, it is trying to hold the two roots together, preventing the roots from getting separated. So, the interradicular fiber is the one that will cross the alveolar bone and attach one root to another, seen only in multi-rooted teeth of the same tooth. Moving on to the Sharpie's fibers. Now, this collagen that was present in the periodontal ligament has to be attached. So, it will be attached to the cementum on one side and the bone on the other. Now, this collagen that has got inserted into the cementum and the bone, the inserted part is called as Sharpie's fibers. So, Sharpie's fibers are nothing but collagen fibers of the periodontal ligament that have got inserted into the cementum and on the bone on the other side. When they are inserted into the cementum, the thickness of the Sharpie's fibers is less as compared to those that are inserted into bone. So, if you look at the bone, the part of the fibers that have entered into the bone are much thicker as compared to the Sharpie's fibers that are present in the cementum.